Let's talk about dog bite because at this stage, people still make a very dangerous mistake. Because why would dog just bite you and you just wash your hand or just rub herbs and ignore it? What people fail to realize is that a simple dog bite can give them rabies. And once rabies starts showing signs and symptoms, it's almost very fatal and very hard to control. So in this video, I'll quickly explain the emergency things you should do, the first aid things you should do before you go to the hospital. Dog bites are common injury that can lead to very serious infection, just like rabies, if not properly managed. But knowing this step can help you save someone's life, even manage someone's life properly. A dog can introduce bacteria and also transmit rabies, which is a very deadly viral disease. And this disease normally affects our nervous system. That's why it's a very big risk, and this person needs immediate proper care. And when you talk about immediate proper care, you first of think of what first aid. And now, in the bracket of this first aid for this dog bite, the first thing to do is to what? Wash that wound under running water. I didn't say under bowl water or water inside a bucket. No, under running water for the next 15 minutes. Now, while you're washing this thing, it helps to remove the saliva of that dog or even reduce the risk of what rabies contamination. The next thing to do is what apply pressure. You apply pressure in that wound area to avoid what gushing of blood, losing of blood, and stuff like that. The third thing to do at this stage is to what apply antiseptic. You apply antiseptic around the wound, antiseptic like Providon iodine. You apply it around that wound to avoid any form of what contamination or infection of any kind towards that wound. After this first aid you render to this your patient or this your loved one that dog bite, the next and most important thing to do is for them was to seek medical care. You carry them to the hospital, to the medical facility for doctors to evaluate that wound, to assess the wound, to know the depth of the wound, to know the risk of rabies or any form of bacterial infection on that wound. Normally, doctor usually even clean the wound again, even after your first aid, running of water, cleaning and stuff like that. They clean the wound in their own sterilized process. They clean the wound, they cut out some dead tissues, and sometimes they don't even stitch the wound unless it is very necessary. If it's necessary, they stitch it, but if it's not necessary, they don't stitch it. They leave it for more what evaluation and more what assessment. Now, when it comes to the bacterial infection, doctor usually recommend antibacterial drugs, antibiotics, like when you see amoxicillin, or if the person is was allergic to penicillin, doctor recommend metronidazole or even what dioxycycline antibiotics. Because this rabies disease is very fatal once symptoms appear, prevention after exposure is very very critical, because once dog actually bite a person, when you give the person like rabies vaccine, it helps to protect the body against any form of what, virus. But in most severe cases, doctor often give rabies immunoglobulin to actually provide produce antibodies that fight this what virus. Dog bite can introduce a form of what bacteria which can cause something like tetanus. And once this victim or this patient vaccine status is not known or maybe it's outdated, doctor often give what tetanus toxoid to prevent what tetanus. Now when it comes to that dog, don't kill that dog. Oh. Just monitor that dog for the next 10 days, monitor any sign of rabies if the dog behave unusually or anything. But within that 10 days after that dog bite, you don't notice any sign from that dog, it's a notable sign that the transmission of that rabies is very low and you might be safe at this
Management,
point. In summary, management of dog bites include washing of wound, applying pressure, applying antiseptic around the wound, medical evaluation, go to the medical facility and be evaluated, antibiotics, tetanus toxoid to prevent what? Tetanus. And lastly, proper and prompt medical attention when you have dog bite is very, very essential to avoid what? Serious complication. Till next time, follow Odinaka Summary for simple educative health education. Till we meet again, doodles.